Viral infections in the dermatology module. By the end of this topic, you should be able to define viral infections, explain the pathophysiology of the disease, outline the causes and classification of viral infections, describe the clinical manifestation, outline the investigations done, discuss the principles of management, and discuss the complications as well as prognosis of viral infections. Let's get started. Before we begin discussing further, let's begin by understanding what is herpes zoster and herpes simplex infections. So the word herpes and zoster originates from the Greek words meaning to creep or crawl and belt or girdle respectively. Herpes zoster is also known as shingles in a viral syndrome due to the reactivation of the varicella zoster virus, the virus causing chickenpox, which manifests as painful skin rashes with blisters. While the word simplex in herpes simplex has a Latin origin which literally means single. Herpes simplex is a viral infection by the group of herpes virus 1 and herpes virus 2. So how does herpes zoster come about? Starting with the primary infection with varicella zoster virus, there will be diffuse varicella infection, which as we all know is known as chickenpox. Varicella zoster virus from vesicles will track along neurons to the dorsal root ganglia or the cranial nerve 5, leading to latent infection. Factors that cause a weakened immune system, basically causing the host to be immunocompromised, such as old age, HIV, and taking immunosuppressive drugs, which may cause reactivation of this latent varicella zoster virus infection. Varicella zoster virus will then spread between neurons in the dorsal root ganglion, tracking out along all spinal nerve and trigeminal ganglion. As a result, there will be features of herpes zoster ophthalmicus and neuronal loss or fibrosis. Next, let's understand the pathophysiology of this infection. As we have said earlier, the causative agents of herpes simplex infections are herpes simplex virus 1 and herpes simplex virus 2. Therefore, it is important to be familiar with the properties of these viruses. Firstly, these viruses have the capability to invade and replicate in the nervous system. Therefore, they are said to be neurovirulence. The next property would be latency, where they are able to establish and maintain latent infection in the nerve cell ganglia proximal to the site of the infection. In addition to that, herpes simplex 1 and herpes simplex 2 can undergo reactivation. Latent herpes simplex virus may be induced by various stimuli such as fever, trauma, emotional stress, sunlight, and menstruation, resulting in recurrent infections. Lastly, herpes simplex virus has the ability to be transmissible via close contact, where there may be inoculation of the virus into mucosal surfaces or via small cracks in the skin. The etiological agent of herpes zoster infection is an enveloped virus that has double-stranded DNA belonging to the herpes virus family, which is the varicella zoster virus. Meanwhile, the causative agent of herpes simplex infection is simplex 1 and herpes simplex 2 viruses, usually acting on the oral epithelium and genital epithelium respectively. Virus activation from its latent stage may then occur due to many factors such as external re-exposure to the virus, acute or chronic disease, medications, and stress. Herpes simplex infection may be classified into herpes simplex 1 causing mouth, throat, face, eye, and CNS infections, and herpes simplex 2 virus, which causes anogenital infections. Now, we will go through the clinical manifestation of both herpes zoster and herpes simplex infection. Let's begin with the symptoms of herpes zoster infection. Patients will usually complain of fever, malaise, any excruciating burning pain, and the outbreak of vesicles over 3 to 5 days, with lesions distributed unilaterally. The signs seen in herpes zoster infection depend on the phase the disease is in. There are 3 phases. Firstly, you have the pre-eruptive phase, where there will be abnormal skin sensations or pain within the affected dermatome, as well as photophobia. Secondly, there is the acute eruptive phase, where there will be the presence of vesicles and symptoms. The vesicles usually start as macules and will progress into painful vesicles which will rupture, ulcerate, and form into crust over a period of 2 to 4 weeks. Lastly, chronic infections are when there is recurrent pain for more than 4 weeks, paresthesia, shock-like sensations, and dysesthesias. Some patients with herpes zoster, otitis, or Ramsay-Hunt syndrome type 2 may present with vertigo and hearing loss. On examination of the mouth, you may notice vesicles or erosions occurring over the mucous membrane of the upper or lower jaw. There also may be signs of ischemic necrosis, osteonecrosis, tooth loss, periodontitis. When the ophthalmic division of the trigeminal nerve is affected, you will see signs of keratitis, uveitis, and even optic nerve palsies. Moving on to the symptoms of herpes simplex infections, patients infected with herpes simplex 1 may complain of cold sores on the lips, which may be painful with a burning and tingling sensation, or cornea of the eyes, whereas those infected with herpes simplex virus 2 will come in with genital herpes. Those with primary genital herpes will have a fever, headache, malaise and myalgia, pain, itching, dysuria, vaginal and urethral discharge, and lastly, tender lymphadenopathy. Generally, the patients may also experience anorexia and listlessness. Those with acute hepatic pharyngotonsillitis can present with fever, malaise, headache, and a sore throat. Moving on to the signs seen in herpes simplex infections, orofacial herpes usually presents as multiple, round, superficial oral ulcers with acute gingivitis, high temperature, tender regional lymphadenopathy, and perioral skin infection. Herpes labialis, on the other hand, will appear as erythematous papules developing into tiny, thin-walled intraepidermal vesicles which eventually become pustular and ulcerates. In women, hepatic vesicles will be seen around the axonal genitalia, labia majora, labia minora, vaginal vestibule, and introitus. In most areas, these vesicles rupture, forming tender ulcers and causing the vaginal mucosa to become inflamed and edematous, as well as the cervical mucosa to become ulcerative or necrotic. Patients may show signs of cervicitis, urethritis, as well as dysuria. However, in men, hepatic vessels will be seen around the glans penis, prepuce, shaft of the penis, scrotum, thighs, and buttocks. There are a few investigations that you may order to help you arrive at the appropriate diagnosis. For herpes zoster infection, a Zank smear of vesicular fluid may show multinucleated giant cells. You can also order a varicella zoster virus specific IgM antibody, which can show any active infection of chickenpox. For herpes simplex virus, you can do a tissue culture which should yield positive results within 48 hours. Doing a Zank smear may also be beneficial. You will see multinucleated giant cells and eosinophilic intranuclear inclusion bodies in patients who are herpes simplex virus positive. Other investigations that should be ordered to investigate for any complications and associated findings would include a direct fluorescent antibody testing of vesicular or corneal fluid, as well as a PCR testing of vesicular fluid, corneal lesion, or blood to check for any eye involvement, as well as disseminated infection for herpes zoster infection. Conversely, brain imaging may be indicated in herpes simplex infection to check for herpes simplex virus encephalitis or for any focal localization in the temporal lobe. Generally, the management of herpes zoster infection is aimed at resolving the lesions, decreasing any acute pain, and preventing any post-herpetic neuralgia. This can be managed by giving antiviral therapy. In the case of herpes simplex infection, the goal is to interfere with the viral DNA polymerase in order to stop the viral replication. This once again can be managed using antiviral therapy. The antiviral therapy given in herpes zoster would be acyclovir 800 mg, valacyclovir 1 gram, or famciclovir 500 mg. Topical antibiotic creams such as mupirocin or soframycin may be prescribed in order to prevent any secondary bacterial infection. Lastly, analgesics such as topical lignocaine or nerve blockade is given to relieve pain. In severe cases, you can consider giving opioids. Herpes simplex virus, on the other hand, can be managed with either oral, intravenous, or topical antiviral therapy such as acyclovir, valacyclovir, and famciclovir. For herpes simplex infection, the complications are based on some features. If there are bacterial and fungal superinfections, the complications may include balanitis or candidal vaginitis. Patients may also develop unilateral follicular conjunctivitis or acute hepatic keratoconjunctivitis with dendritic corneal ulcers. Lastly, patients may have skin infections such as eczema herpeticum, herpetic whitlow, and herpes gladiatorum. Now, as we look at the prognosis, herpes zoster infection usually resolves within 10 to 15 days, having a fairly good prognosis. Good prognostic factors include younger healthy patients, whereas bad prognostic factors would be elderly patients and pregnant individuals. For herpes simplex infection, the infection is usually temporary and resolves most of the time without any detrimental sequelae. However, recurrence is common. Now let's summarize. Shingles is a viral syndrome caused by the reactivation of varicella zoster virus, the virus causing chickenpox, whereas herpes simplex infection is also a viral infection but caused by herpes simplex virus 1 and 2. These infections may arise after infection following varicella zoster virus, herpes simplex virus 1 or 2 from a primary infection, which lays dormant in the nerve cell and is reactivated due to factors such as old age or immunosuppression, manifesting as secondary infection. Patients will present with constitutional symptoms and vesicles with either clear or yellow fluid. Generally, the diagnosis is based on the patient's history and clinical exam, Zank smear, and viral cultures. Antivirals are prescribed to slow down the progression of the disease and to prevent secondary bacteremia. It is also helpful to prescribe the patient some analgesics to reduce any pain. We have come to the end of this topic. Thank you.